Well, ma'am, there are couples who have faced multiple IVF failures. What is your suggestion for such couples?
Multiple IVF failures is a condition where the people have tried repeated cycles of IVF and still unable to conceive. So usually, technically, we give this terminology for people who have had 3 or more failed IVF cycles. So this is a very distressing situation. It's not just for the couple, but it's also for the doctors as well, because we plan this treatment and we try to find the nuances of infertility and treat every single small factor that could be the reason. But still, we fail sometimes. Okay, so we really need to rethink the entire schedule and the entire treatment protocol and see where the fault lies. So it's more like a seed versus soil theory. Now, for a plant to grow, we need a proper seed and a proper soil and a corresponding environment for this to get fertilized in the soil and give rise to a plant. So similar to that, we should say that probably even in IVF, we need a good embryo which could represent the seed, and we require a good soil or which could represent the endometrium of the uterus. So once this embryo is implanted in the endometrium, only then we can have a proper fetus or pregnancy occurring. Okay, so for this to happen, even the local environment, that is other factors in the pelvis, should also be conducive. So when repeated IVF failures occur, we try to see if there is anything wrong with the embryo. So by and large, just before embryo transfer, we actually look at the grading of the embryo. Like, we can visualize the embryo, we can see the fertilized egg and sperm as an embryo, and we see how good it is, the quality of the embryo. So if there's something wrong with the quality, we kind of know that this IVF is going to fail. But there are times when the embryo looks really good, but still IVF fails. So nowadays, there are certain tests for this known as pregenetic screening or pregenetic diagnosis. So here we take a small biopsy of a single cell from an embryo which is grown until day 5, and we see if there is any genetic problem with this. In terms of the chromosomes, we see whether the chromosomes are abnormal, and henceforth that might be the reason for the failure of this IVF. So here, like what I said, this is just to diagnose if there is a problem. So this may not improve the chance of success, but if the embryo is at fault, we may just not transfer the embryo. So in that way, we prevent the patient from facing another failure. Apart from that, we also test for the endometrium. This is known as endometrial receptivity assay. So that is, we take a biopsy from the endometrium. We mimic a cycle of IVF, and we take a small biopsy on the day when we would probably be transferring the embryo. And we see whether the endometrium is in sync with the embryo, like whether it is okay to receive the embryo on that day. So this gives us an idea whether it is a good endometrium or not. So just in case the endometrium is not prepared on that day, we get a rough idea on which day is good for the transfer. So likewise, we transfer the embryo on such and such a day. So these kind of increases the chances of success of an IVF. Apart from that, we have a whole lot of other treatments there's no evidence that these treatments actually help. So we give some kind of immunoglobulins, like we suppress the immune capacity of the body to reject the embryo, and we try to make it be accepted into the body. So this is known as immunoglobulin therapy. So all these don't really have proof, but we just try these on patients in which all else has failed. Mm-hmm. And then we also give something as intralipid infusions. So these are some kind of infusion of fat content into the bloodstream. So this is also seen to improve the quality of implantation. However, like I said, nothing has major evidence in their favor. So all that we can do is try and do something for the patient. Then there are other things like alternative therapies like Ayurveda, even acupuncture. All these patients do try all these because they're frustrated by the time they reach that level. So it does work for some, it doesn't for some. But there's no harm in trying.